I'm Jimmy Holmes, president and publisher of the San Antonio Business Journal, and I believe I have the lowest education in the room, just a bachelor's. So I want to welcome you all today. Thank you for joining us today for this thoughtful discussion about a most important topic that is increasingly affecting the health of our community as well as our economic health, oncology or healthcare, or cancer care, excuse me. Seated here today are esteemed leaders from both UT Health San Antonio and MD Anderson Cancer Center located in Houston. These organizations have recently partnered as the UT Health San Antonio MD Anderson Cancer Center. We're going to spend the next hour talking about the impact of cancer in San Antonio and how collaboration in patient care and research is essential to improving not only the outcomes for patients, but how creating a streamlined system of care using proven protocols and processes can best support families and caregivers. These thought leaders and clinicians will share more on the rising incidence of the disease in San Antonio. They will also speak to their work together that will positively impact patients and their families while focusing on overall cost or value or healthcare spend for this disease that strikes aging and Hispanic population disproportionately. Please allow me to introduce you to our panelist, Dr. William Henrich, President, UT Health San Antonio. Let's give him a round of applause.
Oh my gosh.
He is a specialist in kidney diseases. Dr. Henrich has served as the president of the University of Texas Health Science Center at San Antonio, now called UT Health San Antonio, since 2009. He received his undergraduate degree from Columbia University and his medical degree from Baylor College of Medicine, and later completed a residency in internal medicine at the University of Oregon Medical School and a fellowship in nephrology at the University of Colorado School of Medicine. Dr. Henrich served as professor of medicine at the University of Texas Southwestern School of Medicine as professor and chair of medicine at the Medical College of Ohio, and as the Theodore Woodward Professor and Chairman of the Department of Medicine at the University of Maryland School of Medicine in Baltimore. He became the Dean of the School of Medicine and Vice President for Medical Affairs at the University of Texas Health Science Center at San Antonio in 2006. He is the author of over 300 articles and chapters and the founding editor of the popular dialysis textbook, Principles and Practice of Dialysis.
Very popular textbook.
Yes.
I can get a copy for anybody who'd like to have that textbook. I carry several in the trunk of my car.
Is it a good read for your children as well?
It's a terrific read. It's a page turner.
Okay.
It's a page
I'll
turner.
take your word for it.
You're going to have to shorten these introductions, Jimmy, or we're not going to get through this.
That's good. You're the boss.
Thank you.
All right. Not bashful. That's good. Next, we have Dr. Peter Pisters, President, the University of Texas MD Anderson Cancer Center, a renowned cancer. Yes. A renowned cancer surgeon, researcher, professor, and hospital administrator, Dr. Pisters returned to MD Anderson in 2017 of December after serving as president and chief executive officer of the University Health Network in Toronto. He completed his master's degree in healthcare administration at Harvard University School of Public Health and did his postgraduate work in Memorial Sloan Kettering Cancer Center in New York. Dr. Pister is a member of more than 24 national organizations, including several for the National Cancer Institute. His own research focused on sarcomas, GI cancers, and other malignancies has resulted in nearly 400 peer-reviewed and additional articles, book chapters, and other publications. Let's give him another round of applause. Next, we have Dr. Michael Kupferman, Senior Vice President of Clinical and Academic Network Development, the University of Texas MD Anderson Cancer Center. What a treat to have you here. Next, we have Dr. Ruben Mesa, Director, UT Health San Antonio MD Anderson Cancer Center. Dr. Mesa serves as the director of the UT Health San Antonio MD Anderson Cancer Center, one of only 4 National Cancer Institute designated cancer centers in Texas. Dr. Mesa currently sits on the National Board of Directors of the Leukemia and Lymphoma Society. Let's give him a round of applause. And last but not least, we have Dr. Cindy Sickora. Dr. Sickora holds the Howard and Betty half-endowed professorship in nurse excellence for patient care. She is a clinical professor and vice dean for practice and engagement for the UT Health San Antonio School of Nursing. Let's give her a round of applause. Dr. Mesa, I believe we have other important guests to introduce in the audience. If you'd like to acknowledge them, please do so.
Yes, please. So we're blessed with a strong representation first from our UT Health San Antonio leadership, our Dean of the Lung School of Medicine, Dean Rob Horomis. Mr. Michael Black, our Chief Operating Officer for UT Health. Bob Leverance, our Chief Medical Officer for UT Health. Carlos Rosendi, our Executive Vice Dean for the Lung School of Medicine. Dean Eileen Breslin of our School of Nursing. And our key service line leaders within the Cancer Center, first Stephanie Shelton, our Lead Administrator for the Cancer Center. Dr. Anad Karnad, our Chief of Hematology and Medical Oncology. Dr. Chua Ha, who leads Radiation Oncology Research. Dr. Nikos Papanikolaou, our Interim Chair of the Department of Radiation Oncology. Dr. Javier Hernandez, who leads our Cancer Surgical Specialties. Dr. Marcia Kinney, who is our Chair of Pathology and Laboratory Medicine. And Dr. Pam Otto, our Chair of Radiology. So as you see, to provide world-class cancer care, it takes a village, and our village has some wonderful folks, so thank you.
Outstanding. So questions have been prepared for each of our panelists today. We will start with these questions and then save the last portion of today's roundtable for additional questions. Our first question goes to Dr. Bill Henrich, President, UT Health San Antonio. Dr. Henrich, you have stated many times publicly, based on your own personal experience, the importance of having accessible cancer care at home. Share your vision for the university and how it impacts patients related to local access for advanced cancer care and research.
I think the answer to this question is rooted in every personal experience people have who face a diagnosis that's as daunting as cancer. And it's compounded by the complexity of accurately diagnosing cancer and then treating it precisely. And so wrapped up in this is the need to provide cancer care as close to home as possibly can be administered, and not to miss a switch on the fact that you give the patient the very best chance to survive, the very best chance for the best outcome. So in partnership with MD Anderson and the great resources of that institution, and with the strength of UT Health here in San Antonio, we're endeavoring to meet both of those goals, to provide cancer care close to home that is leading edge and doesn't compromise, and to get the outcomes that you would expect from the very best places in the world, giving everybody the maximum chance to survive. Now, most of you in the room know my personal story that has been told in public on more than one occasion, and it is that 8 years ago I was diagnosed with a disorder that required me to have a stem cell transplant to survive. That disorder was called myelodysplasia, and the kind of therapy that was required, first to diagnose it accurately was a difficult issue, but then to treat it accurately was even more of a challenge. And the kind of stem cell transplant that would cure the disease could only be done in a few places. And my wife Mary and I relocated to Houston to have this done, We lived there for 6 months, and I had every advantage that a person could have, except one, and that is I wasn't home. I was living in a nice apartment with a beautiful view in Houston, and it wasn't the same as being home, close to family and friends. And so it's my personal pilgrimage to make certain that everybody who faces a challenge like I have faced in this community of San Antonio can be treated close to home and can be given the very best therapy available anywhere here in San Antonio. And it's our pledge in building this team that you heard introduced just now, and in partnership and collaboration with Dr. Pisters and this incredibly talented deep bench team from Houston, that we'll be able to do that. So a lot of resources being brought to bear, Jimmy. We have a vertically integrated 850-member physician team at UT Health, combined in partnership with the MD Anderson team, and it's our mutual pledge to provide the kind of leading edge care that our community certainly deserves and needs. Last thing to say is our community is expanding. San Antonio is now officially the fastest growing city in the United States. If we don't do this now, and if we don't take the bull by the horns now and move things forward now, then we will be behind. And we don't ever want to be in that position. We want to be ahead of the curve in meeting the needs of San Antonio and our community. And that's at the core of this. MD Anderson has a deep commitment to patient care in Texas and beyond, as do we. And so this is an ideal marriage of talents between these two outstanding institutions, two National Cancer Institute designated institutions partnering for one singular goal.
Thank you, Bill. That was a fantastic testimony and great vision for our city. Our next question is for Dr. Pisters, President of MD Anderson Cancer Center. Dr. Pisters, having previously served the University of Texas MD Anderson Cancer Center, which, by the way, as you know, is number one for Cancer Center by U.S. News and World Report for its Best Hospital Survey, for more than 20 years, and returning to the organization as its president in 2017, how do you see partnerships between MD Anderson and UT Health San Antonio complementing both your organization in the battle to eradicate cancer?
Well, that's a great question. Before I begin to answer, I want to briefly take manager's privilege and just go through the lineup card and really acknowledge and thank the MD Anderson leaders who are here today, because the partnership that they've demonstrated with Bill's team has really been extraordinary and has really driven us to the point that we're at now, where we can come together and really talk about the amazing teamwork that's been generated. First, Miguel Rodriguez-Bigas and Jeff Lee, who are both members of my own department, surgical oncology. Thank you guys for coming. Steve Hahn, Chief Medical Executive. Where's Steve?
He's on the phone.
No, on a conference call. And Mike Brown, who leads our MD Anderson Physicians Network as CEO. Tad Pullen here for strategic opportunities and for institutional advancement. We've got Chris McKee in the back of the room, and some great people supporting our relationship, Julie, Penny, Marvetta, and Lashandra. Where are you guys? Outstanding. Just to really come more directly to your question, I think when you think about the benefits and hallmarks of our organization, they certainly include team-based treatment planning and the benefits that accrue to that in terms of outcomes, and now increasingly team-based science. And those translate into outstanding patient outcomes. They translate into incredible discovery. And the combination of those outstanding patient outcomes and great discovery are really what drives the institutional reputation and our #1 status. As we've done that, we've been proud members of the UT system. We're recognized really as world leaders coming from Texas, but we're poorly geographically positioned in the state of Texas, stuck in the corner of the state and not really optimally positioned to serve the majority of Texans. Therein lies the opportunity really created by the UT system and by strong institutions and medical schools like we have here in San Antonio. When we look at the challenges that are facing this community, especially the population growth, it's very important that services that are important to that population growth, such as education and healthcare, are properly positioned and strategically advantaged for the future of San Antonians and for the residents of South Texas who see this as a resource for their tertiary and quaternary care. And so as we think about the future of cancer care, as Bill has described through his own personal lens, it's very important for us as leaders to really think about how we're going to meet the increasing cancer burden for residents of San Antonio and South Texas, and then how can we advance research for the benefit of Texans as a whole. There are a whole series of cancers that are unique to the Hispanic population that's resident in South Texas. Liver cancer is an excellent example. And we're working now for a direct example on a CPRIT grant that brings together components of the UT system, including UT San Antonio and MD Anderson, to really focus on that. That brings research excellence to a clinical problem that affects patients in a unique part of the state, and shows the partnership and the benefit of strategic research partnerships that we want to really enhance as we really advance our future. As I think about the future of MD Anderson under my leadership, I want that to be associated with collaboration and teamwork. And that really is being exemplified through the really advancement of strategic partnerships around the state that Dr. Kupferman can talk about in more detail as he answers his questions. But those partnerships are really designed to benefit Texans in the future. That benefit certainly includes those who will develop cancer in the future, who hopefully can receive cancer care measured and benchmarked against our quality standards close to home. And it also includes a shared commitment to the education of the next generation of healthcare professionals who will provide cancer care for many of us, and including many of us in the room who are destined to develop cancer in the future. It also includes, very importantly, a commitment to prevention. Many of you may be already aware of the strong, long-standing, decades-long commitment that MD Anderson has to prevention. That's the science of prevention, and that's also the concepts of implementation science. How do we create scalable projects that prevent cancer that can be scaled up to the population level? As we partner around the state with UT San Antonio and with other members of the UT system, this creates an opportunity for us to bring prevention services across the state, to look at the children of Texas and to ask the question, why aren't they vaccinated against HPV? How can we protect the children of Texas against the ravages of 6 different types of cancer? What are the approaches that we need to use together to push back against the pseudoscience that's preventing many of the children in Texas from being protected against the lifelong risks of cancer? How do we work together, as you've done here in San Antonio, to prevent smoking and to make tobacco products not available to teenagers at a time when they are at risk of becoming addicted or developing the ravages of a lifelong addiction to nicotine? These are things that we can work on together to benefit the health of Texans, to improve the education of healthcare professionals, and optimally to ensure that great cancer outcomes are available for everybody in Texas close to home.
Thank you, Dr. Pisters. Dr. Kupferman, the MD Anderson's Cancer Network is designed to advance MD Anderson's mission of eliminating cancer through collaboration. What are the key elements of the MD Anderson Cancer Network that drive greater value or make it most effective, a national model, if you will, in elevating the quality of cancer care?
Well, thank you, Jimmy. I appreciate the question. You know, we have a very bold mission at MD Anderson, which is to cure cancer not just in Houston or the state of Texas, but nationally and globally. And there's only a certain bandwidth that we have to care for patients in Houston. And so we asked the question, how do we extend some of our knowledge and care pathways, our expertise to other organizations, not just in the state of Texas, but across the United States? And it's through a process of finding the right partners, the right fit that we can work with in a cooperative manner to really extend that mission, to really enhance the care of patients with cancer and really change how cancer is being delivered within one's own community, not within Houston itself. And what we've developed over time has been a very extensive network of organizations that we work with. It's a very intensive assessment process. It requires a really strong partnership, strong integration of our teams in order for these to be successful. And the approach that we take is to utilize our best-in-class therapeutic pathways, our protocols, our knowledge, and really transfer each of those components to the organizations that we work with. As detailed as when certain medications are given, how radiation therapy is delivered, the type of surgery that doctors should be using for patients with cancer. And it's this fully integrated approach to transferring that knowledge to these other organizations that allow us to extend that knowledge and enhance the care of patients within their own communities. And as Dr. Pisters and Dr. Henrich pointed out, to allow patients to stay at home for their cancer care with their loved ones. And so it's through this process where we work very closely with the physicians, the nursing teams, the administrative teams, to create this mutual culture of bidirectional communication, where we can enhance the value of care being delivered and hopefully be able to decrease the cost of cancer. We know that cancer is associated with significant financial toxicity to patients. It's very expensive to take care of a patient with cancer. And that burden can be lessened by having standardized protocols. We reduce that variability that we see nationwide in cancer care delivery. And we seek to have not the approach, but an approach to each of the diseases that we treat. And that relative uniformity of care can lead to decreased costs of care for patients, and most importantly, allow us to ensure that these patients who are being treated for cancer at these locations have an outcome that we would all want for a loved one. And it's through our mutual interest in developing quality of care pathways for our patients to be able to measure that quality of care that's being delivered, measure the outcomes of those patients who are receiving that care, and really have an open exchange and dialogue about what's working in your communities, what's not working in your communities. And we also extend that same approach to clinical trials. There's an opportunity for us to take our expertise in delivering novel experimental care to other communities, to other healthcare systems, and allows us to undertake new approaches to treating cancer in places that we really don't have access to. The way we'd be able to study breast cancer or lung cancer in the community is not really feasible in our own organization because of the patients that we see. It's only through partnering with other organizations that we can truly change the outcome of patients on a national level. And it also allows us to really craft what that outpatient or inpatient experience looks like, so it's relatively standardized. And so a patient walks in and knows what that care delivery pathway is going to look like, and they know that the person sitting next to them is going to have a similar journey, and allows us mutually and collectively to be able to track the outcomes of those patients. And for those who are having to pay for the care of those patients, it ensures that the care that's being delivered is of highest quality and is really at the cutting edge, best-in-class, evidence-based, but also helps to contain that cost of care that is so important on the national landscape today.
Thank you, Dr. Kupferman. Dr. Viles, UT Health San Antonio MD Anderson Cancer Center, uses the term, what's that?
So I'm not Dr. Viles.
Yes, I missed your bio. So go ahead and introduce yourself.
I'm pinch hitting for him, but go ahead, read it. His bio is great.
You got to roll with the punches, right. So would you like to introduce yourself? I didn't get a chance to meet you first.
You did, actually. I'm Dr. Sickora.
Okay.
I'm Vice Dean of Practice from
I'm
the
so
School of
sorry.
Nursing. And I'm pinch hitting for Dr. Jeremy Viles, who was out with the flu. We had to send to the emergency room Dr. Mesa, I think, on Sunday, because he was quite dehydrated.
We are deeply grateful for Dr. Sickora's, both her leadership and pinch hitting. So thank you, Dr. Sickora.
And just so you all know, the president asked me to use my best Texas accent, and that's pretty much impossible. So you're stuck with New York. So I'm extremely grateful for the opportunity to be sitting here with this esteemed group of gentlemen. I think the fact that nursing is at the table speaks for itself, in that we have identified the importance of patient centricity and the importance of taking care of not just a disease, but families. And I think that when bringing in Dr. Viles, who is not here, but was part of the MD Anderson team, and has really demonstrated exceptional improvements in nursing care across the system for MD Anderson, speaks for itself in terms of what we're trying to do here in San Antonio. I think that one of the most important pieces of cancer care is the fact that we remember that patients and families really are at the center of what we're doing. And I think nursing is a really critical part of that, but also being part of the interprofessional team of physicians and social workers and physical therapists and occupational therapists really means a lot to that whole family system and to the patient that we're taking care of. So I think that's one of the really huge things that Dr. Viles has been paying attention to since he's joined us, is making sure that we're really treating the whole patient, the whole family, with an interprofessional approach to care. The other, I think, really critical piece of this is that we are housed in the School of Nursing. And as part of the School of Nursing and this amazing health science institution, we have the opportunity to really integrate what we're doing in terms of research in all of the different disciplines into the practice here at the Cancer Center. And I think it's a huge opportunity for all of us to demonstrate the incredible work that we're doing, not just in nursing and not just in medicine, but really across the health sciences to improve the care that's being delivered in San Antonio. So I thank you.
Dr. Sickora, thank you very much, and I do apologize. Dr. Mesa, our last panel question comes to you. As a physician, you have undoubtedly seen the impact of cancer diagnosis on patients and their families. Not only must patients and families deal with the emotional aspects, but there's often a devastating burden of cancer on patients, caregivers, and families related to managing the disease, care coordination, and expenses. How does the partnership with MD Anderson Cancer Center bring value to cancer care for patients in San Antonio?
Well, great. Well, thank you very much, Jimmy. As introduced, our center is the UT Health San Antonio MD Anderson Cancer Center. And as I like to say, we have a long name, but we have a simple mission. And our mission is to decrease the burden of cancer for the people of San Antonio and for South Texas. And it is such an honor to be able to walk and try to achieve this mission with this close partnership with our friends and colleagues from MD Anderson. Now, your question gets at the core issue really of value. Cancer is one of the most devastating illnesses any of us can face, personally or in those that we love. It is a deeply personal, emotional, and difficult journey regardless of the outcome. Now, value is both outcome and the resources that are used to achieve that outcome. Now, value very much builds from an individual's perspective. Value as it relates to the patient, because that's where we begin. When I took this position with the vision of Dr. Henrich to decrease that burden for the people of San Antonio so that they don't have to leave their homes like he did to get care, we always start with the patient. So what does that value look like in terms of the patient? Their family, the people of San Antonio, the people of Texas, our country, the world, and as an NCI designated cancer center, the National Cancer Institute. So let me walk you through that as we try to achieve our mission through four 4 things that we focus on and how we try to add that value. So first, we really focus on our community. This center is deeply about this community. It's about caring for people in this community. It's about studying the cancers that are prevalent in this community. It's about prevention and screening in this community, San Antonio and South Texas. Our focus is here. Our focus is on the people that we serve. And that includes, including in that mission and bringing value, everything we do across our center, from primary care, through all of our specialties, through our cancer care process, through survivorship and palliative care. It involves focusing on the biology of cancer. We can be more effective in how we treat cancer. How we improve that value is by having more effective treatments, finding it earlier, preventing it from happening. The best cure for cancer is to never get cancer to begin with. So we have an extraordinary bench of scientists here that really focus deeply on the biology of cancer. Why do we get it? Why does it progress? And how can we stop it in its tracks? We focus on better cancer treatments. In this center, a center of discovery, over 20 of the drugs that have been used in cancer today were first tested here. That unquenchable spirit of discovery remains. We have a world-leading program that we focus on together in the development of new therapies. But value is beyond just new therapies. It includes how we most effectively administer the therapies that we know are effective. How do we help people recover faster? How are we mindful of the amount of therapy that's needed? One of the big evolutions in cancer care, one that you don't hear of, is we now have learned that sometimes less is more. Our radiation oncologists have been at the forefront of realizing that we may be able to cure cancer with much less radiation than we used to before. That brings value in terms of resources, that brings value to the patient in terms of less side effects, that brings value in terms of less long-term negative outcomes from that radiation therapy care. It involves transforming how we care for our cancer patients that require surgery, having them be in better shape when they undergo surgery, prehabilitation for surgery so that they're in better shape, working together as one team to optimize how the patient first undergoes that surgery is crucial for their long-term outcomes. How do we evolve and partner with MD Anderson as the science of how we deliver surgical cancer care really evolves? How do we improve those outcomes after surgery so that people are back to their normal lives, back to work in the most rapid time frame possible? It's around working with our colleagues at MD Anderson for really, we continue to question what is the optimal way we deliver cancer care. We speak of these MD Anderson protocols, but these are deeply shared protocols that Peter and Michael and I and all the colleagues around the network really work together disease by disease, trying to decide for each disease at each moment in time, what is the best way we can care for patients under our care to have the best outcomes, to help them recover the fastest, and to be the best stewards of those resources involved. And finally, we focus on our patients. Indeed, walking the cancer journey is more than the absence of the cancer. Someone has a cancer, just waving a wand. If the cancer is gone, the patient is not yet healed. That is a difficult process. It's an emotional process. It's a physical process. It is an active process to recover from. It's one that many in the audience just looking around I know have been directly impacted by cancer themselves, and clearly all of us likely have to go no further than a loved one to know what that person went through. So we sit and we ponder and we say, well, if my mother has cancer, how do I want her cared for? How do I want our nurses supporting her? How do I want us to realize whether she has pain or nausea or help with symptoms? How do I help her to recover from the therapy that she's had? What programs can we develop that are both a resource for patients whose native language is Spanish or English or another culture? How do we support all of these patients here in San Antonio along their cancer journey? So we focus deeply on value. Value to the patient, value to this community by offering that care here in San Antonio, and value to our national audience and the National Cancer Institute by helping advance how we treat cancer through our discoveries and also helping to inform the world what we learn about the science of cancer, in particular in Latino patients, as we serve our community.
Well, thank you. Thank you to all of you for your answers. Now, let's open the floor for any questions. To ensure they are answered by the most appropriate panelist, I will defer to you, Dr. Mesa, to facilitate the question and either answer or delegate to fellow panelists. So what questions do you all have? Don't be shy.
Well, perhaps I'll kick it off. I know sometimes it takes a little bit to get the creative juices flowing. So perhaps Dr. Pisters, clearly under your leadership there are some important changes ongoing at MD Anderson under your leadership. How do you envision some of those changes to potentially be a resource here for the people of San Antonio through our partnership?
Well, I think that, as I was mentioning, one of the biggest changes for our organization is to be both internally focused for our own evolution, but also externally focused for the benefit of Texas. And as we do that, that will create tremendous opportunities, I think, for research collaborations and for improved clinical care going forward. We're learning lessons about that in our local Houston market, where we've been working for some time, over 15 years, gradually and surely to build bigger and bigger, more and more like our main campus. And that has really created a learning lab for us to really learn about how to expand clinical services, how to ensure that quality is maintained, and really taught us a lot about how to build these types of partnerships. As we've done that, we've really changed internally as an organization, recognizing the full components of our mission to eradicate cancer across Texas and around the nation. And I think this partnership is an excellent example of some of the other relationships that I was alluding to with UT Tyler, with UTMB, scientific relationships that we have with UT Southwestern, and collaborative opportunities that we have with UT Health right in Houston that are very, very important to our future. So we're very excited about that future and about working together with Bill and his team here in San Antonio.
Great, thank you so much. Questions, please.
Yes, what does it mean to be an NCI designated cancer center, and what does that bring to here in joining two NCI cancer centers?
Great. Well, thank you for that question. Perhaps I'll take that on. So the National Cancer Institute is part of the National Institutes of Health, and it was created in the early 70s as part of the war on cancer. And that effort, which helps to steward the majority of cancer research done in the United States, had as one of its first programs the development of these NCI-designated centers. Now, the focus of these centers was for them to decrease the burden of cancer in their communities, whether large or small, however those communities were defined. And they were tasked with decreasing that burden of cancer across the spectrum. First, better understanding the biology of cancer, advancing prevention and screening, advancing therapies, but in particular, being a platform for discoveries to be able to translate it into clinical trials so that those most cutting-edge therapies would be available across the United States at these centers. And then finally, a strong focus on the population science of that region. So we know that our region has certain cancers that are overrepresented: cervical cancer, liver cancer, endometrial cancer. We know there are cancers that patients in our area may not have them more frequently, but they tend to have worse outcomes. Our center just published that we identified that patients with acute leukemia in South Texas do worse than we might expect. And we're trying to figure out, why is that the case? Is that a delay to access of care? Is that a higher risk types of leukemia based on genetic predisposition? Is there a cultural impediment in terms of receiving the care? It involves better understanding barriers to care. the human papillomavirus vaccine can help to prevent certain types of cancers, both of the head and neck and of the cervix. Yet the vaccine is received at probably the lowest rates in the country here in Bexar County. One of our investigators, Gail Tomlinson and Allison Grimes, just received a grant along with the rest of the team to try to find ways to augment the rate of HPV vaccination in our community. Are people afraid of the vaccine? Are there implications of taking the vaccine that might be misconstrued? So it's a deeply focused way for resources in research to really help to decrease that burden of cancer. It's a highly competitive process. There are 4 NCI designated centers in the state of Texas. Many states have 0 or only 1 NCI designated cancer center. Sir.
Bill, obviously a partnership like this is a complicated thing and it will develop in stages. So kind of where are we in that timeline of, we've announced this partnership, where are we in terms of implementation? What does that kind of look like?
And for those who didn't hear the question, the question from Mr. Belden is, where is the process of the partnership? How far along is it? Maybe I could borrow, of course, everybody on the panel might have a different answer for the question, but maybe I could borrow a well-worn phrase from Churchill, who, in speaking about a phase of World War II and the Battle of Britain, said it was the end of the beginning. I think that's about where we are. We undertook about a year and 3 months ago a major effort to put in place the care pathways that Dr. Kupferman mentioned. And Dr. Mesa and the ABLE team that has been here at our cancer center has been hard at work in implementing those. And that's sort of the infrastructure that we had to get in place. In addition, we needed to recruit a deeper bench in some areas of cancer care. That includes nursing. It includes some different expertise in specific cancer areas. And that has taken about a year and a quarter to build up. And I think, if I might embarrass Peter by saying this, but I think that the changes in leadership at MD Anderson that occurred were part of the integration of this new plan, and frankly, that had to happen as well. So when you add all of those ingredients together, the changes in Houston, the changes here, the fact that this has been a dynamic, evolving process has led us to a point where now we're ready to, in essence, take the wraps off and to increase the aperture of the organization for receiving patients with cancer from around the area. And additional plans about collaboration on clinical trials, on other areas where we now can start focusing, now lie ahead of us. So, and then let's be honest, Mike, there'll be bumps along the way because we have, we're dealing with complicated organizations, large organizations, and Peter and I are committed to taking the necessary steps we need to take in communication such that the process is expeditiously advanced. And again, to provide sort of the shining city on a hill vision is that we will provide expeditious and world-class care to everybody whom we are privileged to care for. And so I think that's where it is. It's now gotten to a point where it's ready to launch. The ship is ready to sail in full, and it's hard to convey in a meeting like this how much excitement there is about doing that, about getting to this point. You don't see a lot of it on the surface, but believe me, it's been going on, and we've reached a point now that ready to move it forward. You might want to make a comment about what I just said.
No, I think that's an accurate summary. We're beyond the early stages. I think that's a very fair statement. We've got great leadership teams on both sides that are working together on a consistent time and schedule. We've got milestones that have been achieved, and I think from our standpoint, benchmarking this against other network relationships that we have, we're ahead of schedule.
Great. I see a question in the back.
I'm Cindy Atmar from MD Anderson in Houston, and I think I told Dr. Mesa on the way here, coincidentally, I received a phone call from a donor here in San Antonio, and he was asking about, he was just diagnosed yesterday with bladder cancer, and so I'm really glad. After this, I'm going to give him a call and connect him. Thank you, Dr. Mesa. And I guess my question kind of follows on what you're talking about in the timeline and what you, Dr. Kupferman, with clinical trials. Like, where are we? How far out are we from doing clinical trials here in San Antonio?
Sure, I'll take that. I think that the fact that this isn't already has NCI designation to it, it ensures that much of the resources that are necessary for clinical trials to occur, which, by the way, take an incredible team effort for them to be executed, much of those resources are already in play here. And so it's a matter of us finding the right trials for the patients that are here in the city of San Antonio and the surrounding region, and ensure that the trials that we're sharing with your team are ones that, one, the team here could accrue to, and then two, are meaningful to the patients that are seen here. And so we are very close to that point. I would say that of any of our partners, San Antonio was furthest along in terms of its research development because it has all that DNA built into it for 30 some odd years of leading clinical trials for the nation, as Dr. Mesa pointed out, really spearheading many of the pivotal trials that occurred over the decades. And so I think we're at an inflection point right now where much of that will start happening in short order.
And perhaps I'll add, from my end, that is one of the most exciting parts of this relationship, because the special part of us being two NCI centers working together really allow us the opportunity to really strategize, again, around some of these key needs. So let's take liver cancer for an example, and that is a key unmet need. So our specialists, our researchers, their specialists, their researchers are working together to say, okay, well, how can we do this better? Earlier detection, better screening, different radiologic methods for finding the cancer, different surgical techniques, optimizing the leverage of our world-class liver transplantation program here. So many different components, but we're in a unique position with a very robust clinical trial infrastructure and a wonderful array of clinical trials, but to expand it that much further. And as we really try to partner, how do we really take that to that next level across the board and with a deep focus, again, on the greatest unmet needs in this community.
Bill, you described this as a partnership, and that, so before this was San Antonio's Cancer Center. Does that change, or what is the community's role in this?
Great question. Well, the question is about, is the UT Health MD Anderson Cancer Center, honorifically named the Mays Cancer Center, San Antonio's Cancer Center? And the answer is unequivocally yes, it is. And Louise, your question touches on something that should not be lost on anybody in the room or anybody who reads about this affiliation and this the lofty goals we have for it, which is that all cancer centers depend on community support. Each of them, the most venerable of them, no matter where they are, depend on the community's philanthropy to be successful. They just can't succeed without that support. And in this case, we've been blessed. Our community has supported the CTRC and that iteration of the Cancer Center's evolution. And they've supported the UT Health MD Anderson Cancer Center as we've undertaken the major job of expansion. And in no small part, organizations like the San Antonio Cancer Foundation, which was at the heart of the CTRC, has been pivotal in that support as a nidus that started philanthropy here. See, because in the end, the beneficiaries, the major population of beneficiaries for this effort will be citizens of San Antonio and the region around San Antonio. We have a 38-county region that we serve. A geographic size that's vast, 4.5 million people, and a geographic size that rivals the state of Pennsylvania in terms of size. But it's the citizens of San Antonio who will benefit by this association. And it is up to us to demonstrate that benefit to them. We have to be very mindful of that at every turn that we take, that they understand that we're doing this in as much as we can to put ourselves out of business. I mean, we're trying really hard to get at these cures and to develop therapies which are faster and more efficient, because what we want to do ultimately through prevention and better treatments and better surveillance is let's get rid of these places. Let's eliminate the great need we have for them now and relegate cancer to a different place where it stands. So we are here for this community. This is San Antonio's Cancer Center, and we will, among our partnerships, always celebrate that partnership with the citizens of San Antonio for whom we're privileged to care, and for the growing population in this region, which is predicted to grow to another 50% in the next 30 years. And that's amazing. That's amazing. How will we do it all if we don't power up like this and take these steps in partnership? And Peter and I were talking before this meeting about the power of the UT system. We're encouraged by UT system to do this because they see the value of an integrated system ultimately that can provide to the citizens of this great state this leading edge care. The old days of living in silos and being parochial about your thinking or about your place, those days are over. Everybody who's thinking that way is looking in the rearview mirror. They are not the modern way of approaching the future. And Peter and I hope that with these teams and with UT Systems, wind at our back, that what we'll be able to create is benefits to this community and, frankly, to communities around the state.
Maybe I can just add a little bit to what Bill has said already and to what we see as the future opportunity. A big part of that is that we see this as a pathway to create a statewide clinical trials network, and that we're at an incredible inflection point in the evolution of cancer treatment. Right now, the latest estimates that we've seen are that there are 1,500 new cancer drugs going into clinical trials. We literally have more drugs than we have types of cancer. And this means great things for patients. It also means that organizations like ours, and I mean that in the collective sense, need to be strategic about which compounds we move into clinical trials and which patient populations are used to really explore these new therapies. Our network is a huge platform to advance discovery. A great example of that now, just this past month in the August 16th issue of the New England Journal of Medicine, there's a practice-changing paper from an international trial led by an MD Anderson faculty member for metastatic breast cancer. And they're co-authors from the Banner MD Anderson Cancer Center in Phoenix. really demonstrating the capacity of our network to generate opportunities for patients in Phoenix to enroll in a practice-changing clinical trial. We want to see that on a statewide level, and this partnership will be a great opportunity for us to take clinical trials from faculty members here in San Antonio and put those onto a larger platform in Houston and San Antonio, and vice versa. That really creates an opportunity for us to open and close clinical trials faster, because what we're seeking is rapid accrual, faster answers, faster publication of breakthrough therapies. We can do that on a slow scale if we confine ourselves to a Houston population, or we can do it on a rapid scale if we partner and collaborate. And I think that's where we see some of the biggest opportunities. Patients shouldn't have to travel to enroll in cutting-edge therapies. We need to be able to find ways where we can create a common IRB, accelerated approvals, statewide tissue banking platforms, and ways in which we can enhance research and allow patients to stay in their own communities and enroll in clinical trials. I think we're in a new era with respect to patient participation in clinical research. That's been heralded by a number of different initiatives that come from a number of different sources. You can see just one example now. Routinely on cable networks, you see biopharma collectively advertising the great progress that they're making in immunotherapy, personalized cancer medicine, and other therapeutic pathways, making the public really aware of the fact that discovery is coming from both academic centers like ours as well as industry partners. As we do that, patients, I think, are increasingly more aware of the fact that they should be considering clinical trials, and they're seeking out our website and other sources for information on those trials. They will be increasingly connected through a digital pathway to centers like San Antonio and Houston, and at the earliest stages in their cancer journey, they'll be seeking clinical trials options. We need to prepare for that future and then leverage the power of the UT system as well as our collaborative spirit to make great things happen.
Well, thank you very much. We're very grateful for your time today. We're especially grateful for our panelists and their incredible insight around this devastating disease. It's a pleasure to serve our business leaders and the thought leaders of our community through our publication, the San Antonio Business Journal. It's critically important that we all remain informed about one of the most expensive investments our business makes in healthcare spend and the health issues that impact our community. San Antonio has incredible options to improve our city, and the efforts talked about today go a long way in being a model for the country in collaboration with the goal of improving healthcare and reducing spend. Be sure to find a summary of this event in the Friday, September 14th edition of the Business Journal. We'll be recapping it with all the comments and corrected bios. We'll correct that. But first, I thank you all today. Really appreciate the participation. Many of our healthcare heroes are in the audience. It's such a big driver of our community here, and we appreciate the efforts. I wish other industries would take part in more partnerships to learn from each other and expand. So I want to thank you all again today. And that completes our program. Thank you.
Thank you.